Hi everybody, Dr. Benton, Houdini of Healing here with another healing tip. So I have a friend and patient, Pam here, and Pam is feeling very dizzy when she sits up from a lying position. And she sometimes feels dizzy when she lays down from a sitting position. Is that right?
Yes,
How long has that been going on for?
for about a month.
Okay, so it's pretty recent.
Yes,
Okay.
after I had a really bad ear infection.
Right.
I noticed it.
Yeah, so Pam first came here for a very bad ear infection, which we handled quite well, naturally. What I suspect going on is her adrenal glands are really run down. And the adrenal glands produce epinephrine and when they're working correctly. And one of the many things that epinephrine does is it vasoconstricts the blood vessels. And why is this important? Because whenever you go from laying down to sitting or from sitting to standing, you are changing altitude. So the blood pressure in your body whenever you're sitting, for it to maintain that, needs to know that you're shifting altitude and react accordingly. In a properly working body, there's a good feedback system from the semicircular canals in your ears, and if you're standing and changing altitude, to tell the brain that you're shifting altitude, and it would send a message to the adrenal glands to secrete just a little bit more epinephrine to vasoconstrict the blood vessels so you can maintain proper pressure whenever you are changing altitudes, even if it is just 2 feet. But whenever your adrenal glands are so worn down, or there's something off with semicircular canals, then that information isn't transmitted effectively, and we get that dizzy, woozy feeling after we sit up from laying down. And we're going to evaluate Pam and see what's going on with her right now. Push up towards the ceiling. That's stronger.
Yeah, I'm starting.
That is stronger. Good. Push up again. Nice. Okay, good. I checked Pam, and all of her muscles were weak. In probably one of our previous videos, you'll see that I talk about water. But then another important thing is water adds additional volume to your body, into your blood. Hold this arm on. And push against my hand. Okay. So I'm gonna tug on your ligaments and hold. It just blows you weak. Okay. So that's another sign, that's another test, simple test that your adrenal glands are really tired. So I need to send you, and I can send you an article I wrote about adrenal fatigue and ligament stretch fatigue, actually called ligament laxity. So do your muscles or do your bones sort of pop and make a lot of crickety crackety sounds?
Yes.
Okay, that's another sign that your adrenals are weak. Because let me demonstrate again. Hold strong, nice strong test. I'm just going to take your little finger and just wiggle it, stretching the ligaments in your finger, and hold. And it's just that small. So every time you're walking, it's just like, because that wasn't much. Every time you're walking, your adrenal glands are just having a bear of a time getting things to work. So we got some work to do here.
Yeah.
Let me check some ear reflexes. Hold. That looks a lot better. All right, so we're going to test. Let me check your adrenal. And there's a lot of some muscles that are related to the adrenal gland. Bend this leg and bring it down to the side a little bit more. Does that hurt?
No.
Okay. So I'm going to try to straighten your leg. You don't let me.
Okay.
And hold. And there's no.
Try.
Most people, it should be solid. I should not be able to move a very strong leg. I'm actually evaluating the sartorius muscle. This muscle, which originates from the hip and wraps around and attaches to the inner part of your knee, is intimately connected to your adrenal gland. So whenever we're going to put you on like an IV of adrenal supplementation and other cofactors, and you're going to feel better, one, because you're not going to be less dizzy,
Okay.
the ligament laxity will go away, and this muscle test to get stronger.